Hello, my name is Tiara Perry, and today I will be discussing type 2 diabetes and covering the topics: who can develop the condition, testing for type 2 diabetes, problems caused by type 2 diabetes, signs and symptoms, and treatments. What is type 2 diabetes? Diabetes mellitus is the most common disorder of the endocrine system. People with diabetes have problems converting food to energy, and it's linked to excess weight in which your body cells do not use insulin properly. The human body needs insulin to help glucose enter cells. When diabetes occurs, the pancreas can only keep up with the demand for so long by producing more insulin. So, eventually, the pancreas will lose that ability to produce enough, causing the blood glucose to rise. Who can develop the condition? People that are overweight with higher than normal levels of blood glucose can develop a condition called prediabetes. Individuals with family members with type 2 diabetes, prediabetes, obesity, and a family history of other types of diabetes are at risk for type 2. Minorities with high rates of diabetes, including African Americans, American Indians, Hispanics and Latinos, Alaska Natives, and Pacific Islander Americans, also Asian Americans, can develop type 2 diabetes. Others that are at high risk for developing type 2 diabetes are pregnant women and women with a history of gestational diabetes, and seniors that are 60 and older. Testing for type 2 diabetes. There are different tests ran by doctors that can detect diabetes, and they are also able to tell which type of diabetes they are. Glucose antibody testing and C-peptide level testing are some of the types available. Diabetes is screened in 3 different methods: glucose measurements, A1C measurements, as well as the oral glucose tolerance test. Doctors will perform mandatory glucose testing for pregnant women. When doctors see certain signs of diabetes, they will test, and they will also test if there is a family history. Problems caused by type 2 diabetes. Over a period of time, high blood glucose damages nerves and blood vessels. Kidney problems, including heart disease, strokes, kidney disease, becoming blind, dental diseases, and amputations of body parts can occur. An increase of getting other diseases, loss of mobility, issues with pregnancy, and sometimes depression are also caused by having type 2 diabetes. Signs and symptoms. Some of the symptoms include extreme thirst, increased hunger, fatigue, frequent urination, spontaneous weight loss, blurred vision, numbness and or tingling in the hands and feet, sores that do not heal or heal slowly. Most do not find out they have the disease until they have problems like blurred vision or even trouble with their heart. The signs and symptoms of type 2 diabetes may not be noticeable. Many people don't have signs and symptoms at all, but there are some people who have other certain signs and symptoms but don't even expect that it's type 2 diabetes. Treatments for type 2 diabetes. That involves taking diabetic medication, eating a healthy, well-balanced diet, and exercising. Insulin shots are given to those who absolutely need it, and testing blood using diabetic meters are also used to track sugar levels and glucose. Treatments also include seeing a physician regularly to help with monitoring and tracking the progression. There are nutritionists that are available for people who need help with dieting. Treatment also includes keeping blood pressure and cholesterol under control constantly, and some individuals have to take aspirin to relieve some of the symptoms of having the diabetes. That's all I have for today. Thank you so much for listening.